Dear viewers, welcome to today's show Visite. And I'm happy that we will talk about a topic which has taken on a larger dimension than I thought. And I followed the question from a woman from, I was about to say Australia, no, from Austria. And Elizabeth W. writes, she is concerned with the question of a possible breast augmentation and a breast implant. And I would like to answer you, Elizabeth, so that you also get good decision-making skills, because today we know more and we have been mindful for many years about PIP implants. But the deep view of these things is slowly coming due to the study situation now. Rarely, very, very rarely are the old silicone implants tight. Silicone in form of these silicone pads were used since 1960, because it is of course a very promising active ingredient due to the galenics and the soft mass. But the research team led by Dr. Henry Dickman from the Netherlands showed us a lot of things, and even today they present studies that show us that these things also have a big so-called, we say that bleeding has happened. Bleeding doesn't mean it bleeds, but it leaks, it transfers, and the women sweat out this material. That means, from the period 1986 to 2020 for all post-implant removals, and only then, of course, there was control over it. In approximately 389 women who had the implant removed during this period, they saw that 98.8% of all of these silicone implants were leaking. Only 1.2% were tight, and all others naturally caused histiocytic reactions in the surrounding tissue within. Immunological response, so what arose through the penetration of the silicone, came in 92% of these women to an immune activation, that the immune system was under constant stress to attack this foreign body. This is of course also pain that builds up around an implant, and that of course also motivated one or the other to have this implant removed. It was already suspected then that in terms of the local lymph nodes here and visible development to lymphatic tumor diseases, one speaks medically of lymphomas, there is a connection. And these connections are of course now available in terms of studies. Well, I don't want to work with the argument of concern here, but I would like us all to open our eyes a little, and that we know that already 20 years ago there was a clear investigation, that these leaky implants should be taken off the market, but the manufacturers of these have repeatedly reassured, and medicine is actually very rarely really pursuing such toxic strains until now there is someone who takes it really, really seriously. And the problem is actually sweating, because these are of course small, so-called, like gel bleeding, It is called in quotation marks, which can be seen in the electron microscope. And of course the development of medicine is different today, which of course through very concrete elementary analysis detects the highly toxic silicone. These are so small particles which are then coated with fat that it is not visible to the naked eye. PIP is the French manufacturer who had a gel, which officially was not approved and it was therefore considered from the tactile findings and from the placement and from the advantage that it is of course much more similar to a normal breast due to its gel-like structure, than if that is filled with water, for example. That was the turning point back then, that people were already warned about it, but that these saline-filled implants were not taken seriously as an alternative at the time. Dr. Kappel from Norway had already observed this 20 years ago, and in a first public study in 1995 she questioned the supposed safety of these implants. And you also have to know that from 1995 to 2006 in the USA such kind of silicone implants were really forbidden. The toxicity was already known by their studies at that time, described by 29 editors, but the manufacturers have repeatedly denied this, and to this day they are of course allowed. I have just brought you a study situation, and perhaps I may ask that it is shown now. So, for example, there is a very interesting study that shows pericarditis, which is an inflammation of the heart muscle, after such an implant has ruptured. The other are studies that have traced the connection between breast implants and the occurrence of rheumatic diseases. You can see PubMed here, scientifically documented in PubMed, and I would now go to another study, in which you can see that chronic inflammatory processes in the organism, and of course the immune system has the job of responding to any foreign happenings in our body with an attack, that very many also joint diseases, muscular diseases, myalgias are muscular diseases, again and again pyrexia, slight flare-ups of fever. Fever is nothing more than giving the impulse again and again. We have to edit something here: dry eyes, dry mouth. These are things that, through these nanoparticles and through penetration of the silicone in the organism, then also trigger chronic inflammatory processes. And we know today that with every acute inflammation we are confronted with an acute event, that the body breaks down something via acute inflammation, so an acute inflammation is a big attack of the body to regulate a process again. Chronic inflammation is always a disruptive or destructive process, which sometimes takes place in a silent inflammation and we don't even realize it. We then of course have to follow up such a silent and internal investigate inflammatory processes medically today. Obligatory measures for inflammation values are of no use to us, such as C-reactive protein. It's about silent, highly sensitive inflammatory parameters, but what we also see here in this study are cognitive impairments, cognitive means within the framework of my spiritual, mental, concentrated fitness. And here is also proof of all these known silicone implants, the complaints proved by studies, and a third one because also the material examinations was then determined that with increasing aging the material also becomes porous, and then of course penetrates into the environment. And how often do we as physicians not attach any importance to these things at the moment, perhaps from anamnestic perspective? It is very important to talk to your doctor about it. I am sometimes very shocked how few people are clinically examined in detail today. Then these things should really be discussed and then can also be removed as part of a breast implant. These silicone implants are said to bleed out very slowly. I gave you the numbers, but also, as I said, sweating and these recurring chronic inflammatory processes also causes internal scar tissue, and any chronic inflammation also destroys cellular tissue. So women sometimes also describe these states of tension on the breasts, who then also have this background for themselves. You can't detect that via ultrasound or directly determine everything in detail. You just have to know that my colleague in the Netherlands has done electron microscopic examination in combination with an elemental analysis, and was he able to document. Which character also these in fat embedded silicone particles have, which of course also have a lipophilic character and are then partially deposited in the fatty tissue. We now know that the toxicity of silicone is classified as very high. And the colleague said so nicely, or he also wrote that on his studies, if he had that much money then he would very much like to remove these silicone implants for all women, to protect them. And that is of course a point where I say, women who have these monoblock implants in them have fewer problems than the PIP implants. But I don't know if I'd let you walk in there so easily. But we know today that the implants associated with physiological table salt and cellulose on the inside have a much higher security standard. And even if the silicone is downplayed, it would now just be there or there, and very safe. You just have to see, because the last 20 years have simply been watched, and again manufacturers have put themselves there. They would be safe. Today we face another real fact. In addition, as said, the risk is very high. He speaks of 400 times higher, to also trigger lymphatic diseases. And I believe, it's not worth it at all, and I think you have to develop a very clear position and now I think it's very nice that you inform yourself in advance and say, what risk am I exposed to, and do I want that, or maybe I want to get some advice here. Having implants with cellulose and with salt water still have a slight silicone coating, but the release is much lower and no liquid silicone is included. That's the big difference, and the coating is different. I think you have to decide that individually what you really allow for yourself here and don't. The other thing is that you always have to know that an implant is being implanted. There are large scars. These scars can be interference fields, so if you have scar tissue afterwards, after the implantation, you should at least do scar care at large intervals. And this scar care means again and again using a wide variety of options to suppress scars. With all scars, I see that 85% also need this care again and again to suppress scars, because of course you risk the blockage of permanently important meridian flows in the front area, and these are the stomach meridian, that's the governor's vessel in the middle. This is the kidney meridian. And that can of course also be a trend towards the development of accumulation of completely different problems, which of course, if I just think of the stomach meridian that runs down the knee, the same knee right and left, why do I develop arthrosis here and why not on the left? These are all connections that play a very important role. An even greater role, and therefore really the concentration on this topic in this program is, of course, when people suffer from side effects of this silicone implantation and also that the silicone on a physical level now is scattered, how do I get it out again? That means, if I now have a timely removal, so gel bleeding and cracks don't appear in the first place and so on. But when I say I don't want that to be provoked in the future either, can I prevent that at all? But now I want to, and I also want to know that my body stays silicone free, or maybe I don't have any complaints at all. Then I have to show you. An eluate from a patient who suffered quite a bit from silicone toxicity. That means we can usually do it with 2 to 3 environmental apheresis or ionospheresis, which are really the most modern equipped to filter out microplastics, silicone. Of course everything else, heavy metals, pesticides, herbicides, but that is very interesting down to nanoparticles. And you see in the picture that this patient had an incredible flocculation on the first eluate alone, and I put the third eluate next to it for you. This is the result of this very intensive detoxification via an ionospheresis through the environmental filter, which of course helps us very, very much at that moment, because the possibility of a sufficient endogenous, so the sole detoxification via liver, kidney, lymphatic system can be restricted in this case. Of course, this also varies greatly from person to person, and at that moment, of course, we were able to help this patient a lot. But much more important now would be the knowledge I wanted to give, that you take a very critical look again and think about it, not maneuvering yourself into a situation tomorrow that you might have wanted to change. And I think you'll find a lot of hints there too. You can find the entire study situation on the internet, but I think it's important that you deal with it, so that you can recognize things in advance and not just walk into them. Yes, in this sense I'm almost at the end, and sometimes I still have time, and I always give a little diet rule. And I'm actually still not there to recommend things that we consider to be of high health value, but first of all to draw attention to what not to do. And in addition to a healthy diet. No matter what it is or a not so healthy diet, it is very important that you only eat when you are hungry. That's something that not all people respect. There are many people. They simply eat out of pleasure, out of boredom, out of love, out of a certain annoyance, and that's always around the clock. And I would really like to recommend this to you, because the body also needs rest periods. And it needs these rest periods for metabolism. And if we just eat when we are really hungry and eat enough, and 2, a maximum of 3 meals a day, then that would be more than enough. And minimalism is the key in this regard. Good quality, but not the amount is key, the amount overloads. And there is an organ that takes it very badly, and that's always the liver. The liver never wants one too many. And with it you sleep better, with it you can feel better conditioned. And there is a lot in our body that is symptomatic, which is very often really just too much. And the huge increase in carbohydrates today, constantly needing insulin, and thus the counter-hormone decreases in the evening, that is the somatotropin, this is our regeneration hormone. That means maintaining vitality also means fewer meals, high-quality meals, but not around the clock, always a snack here and there. That can actually only put a lot of strain on the whole thing. That just as a final piece of advice, thank you for your attention. If you have any questions or maybe need some help, then please contact Visite at QS24.TV. And I love doing that, giving you some advice, and I look forward to seeing you again next week. All the best, thank you.